Health experts are seeing a dramatic rise in cases of type 2 diabetes since the start of the pandemic. This alarming trend highlights the need for diagnostic tools to screen patients at risk for developing type 2 diabetes, enabling healthcare providers to develop a targeted intervention strategy. The increasing rates of type 2 diabetes and the burdens arising from its complications speak to the limits of current strategies for prevention. There is ample evidence that type 2 diabetes has a strong genetic basis. Understanding the role of a patient's genetics as a risk factor for developing type 2 diabetes can help healthcare providers with addressing some of these challenges, improving the precision on predicting disease progression and response to therapeutic interventions. Genetic risk testing for type 2 diabetes empowers clinicians with access to a patient's genetic information that is not available in any other way. This information, taken in conjunction with the overall clinical evaluation, can help clinicians create the most effective strategy for prevention and management interventions. Knowing the patient's genetic risk factors provides you with valuable information to personalize recommendations, be it specific types of nutrition, physical activity, supplements, medications, or further lab tests. Patient compliance is one of the toughest challenges when treating type 2 diabetes. When a patient can clearly understand their susceptibility with precise recommendations based upon their DNA, they get additional motivation to adhere to lifestyle changes. Premier Medical Laboratory Services is proud to offer Diabetes Predict, a forefront diabetes prevention tool. The test analyzes 16 gene variants associated with type 2 diabetes risk, providing a risk score so patients understand their relative risk for developing type 2 diabetes, along with their genotype, with recommendations on diet, physical activity, medications, supplements, and further lab tests.